Lifestyle levers to extend visual health span. Our eyes work continuously from childhood through old age, converting light into the images we see. Over time, the risk grows for age-related macular degeneration, AMD, diabetic retinopathy, glaucoma, and cataracts, leading causes of vision loss. While genetics matter, research shows that everyday habits can greatly influence eye aging. Choices about diet, exercise, smoking, and general metabolic health play a pivotal role in eye health. By adopting nutrient-rich diets, staying active, quitting smoking, and managing blood sugar and blood pressure, people can delay or reduce the severity of many eye diseases. This article reviews the evidence, explains how key nutrients and activities help protect the eyes through antioxidant and anti-inflammatory effects, and suggests practical ways that eye care providers can weave lifestyle advice into routine care. All major points here are grounded in recent studies, so patients can trust the guidance. Diet and nutrition. Overall diet quality, especially patterns like the Mediterranean diet, is strongly linked to eye health. The Mediterranean diet, abundant in fruits, vegetables, whole grains, beans, nuts, olive oil, and moderate fish, provides many antioxidants and healthy fats. Studies find that people who closely follow this diet tend to have a lower risk of AMD and slower progression of early macular changes. For example, one large analysis showed that medium to high adherence to a Mediterranean-style diet was associated with about a 17 to 36% lower risk of AMD progression compared to low adherence. In practical terms, this means consistent intake of colorful plants and fish, the staple of the Mediterranean diet, appears to help preserve the retina's health. Logically, such a diet is rich in antioxidant nutrients. Antioxidants like vitamin C, vitamin E, and minerals such as zinc neutralize harmful molecules called free radicals that can damage eye tissues. Indeed, classic trials, the AREDS studies, found that antioxidant and zinc supplements can slow AMD progression, and modern advice emphasizes getting these nutrients from foods. Fruits and vegetables supply not only vitamins but also carotenoids, pigments with antioxidant power. Lutein and zeaxanthin are two carotenoids concentrated in the macula, the central retina. Many studies show people with higher lutein zeaxanthin intake, through salads, leafy greens, or supplements, have lower risk of advanced AMD. A 2012 meta-analysis found that those in the highest intake group had a 26% lower risk of late-stage AMD compared to those eating the least. These findings fit the idea that lutein zeaxanthin help filter out damaging blue light and soothe inflammatory damage in retinal cells. Other key nutrients include omega-3 fatty acids found in fatty fish, salmon, sardines, and flaxseed. Omega-3s, like DHA and EPA, have anti-inflammatory effects in the retina. Experimental studies show omega-3s reduce inflammatory signals and protect the neural layer of the eye. Reviews of diabetic retinopathy research conclude that omega-3 intake has antioxidant and anti-inflammatory properties, beneficial for eye blood vessels. In fact, an umbrella of research finds that diets rich in omega-3, part of the Mediterranean diet, may help prevent or slow diabetic eye disease and possibly AMD. For example, one trial of a vision supplement combined DHA with lutein, vitamins, and other antioxidants specifically to target multiple harmful pathways in diabetic retinopathy, reflecting the idea that these nutrients work together to counter oxidative stress and inflammation in the eye. In contrast, many processed or high-sugar foods have the opposite effect. Diets high in unhealthy fats or simple carbohydrates can promote inflammation and oxidative damage in blood vessels, including those in the eye. For people with diabetes, avoiding excess sugar and refined carbs is especially crucial. Good blood sugar control is strongly linked to lower retinopathy risk. Similarly, diets that help control weight and blood pressure, such as Mediterranean or DASH diets, indirectly protect the eyes by reducing strain on retinal vessels. In short, a plant-forward, low-inflammatory eating pattern supports antioxidation and anti-inflammation in the eyes, slowing damage. Physical activity. Staying physically active benefits almost every organ, including the eyes. Exercise improves cardiovascular and metabolic health, which in turn supports healthy eye function. Research on eye diseases confirms clear links. People who exercise most of the week tend to have lower rates of diabetic retinopathy and other vision problems. For instance, a meta-analysis of 22 studies found that diabetic patients who are active have about a 6% lower risk of any retinopathy and even greater protection against sight-threatening forms than sedentary patients. In one large 10-year study of older adults with diabetes, those who walked or exercised vigorously 14 times per week, about 30 plus min daily, had nearly 40% lower risk of needing laser treatment for retinopathy compared to those exercising 5 times per week. This dose response is important. Each step up in activity significantly reduces eye risk. Mechanistically, exercise may protect the eye by improving blood flow and oxygen to the retina, reducing systemic inflammation, and helping maintain a healthy weight and blood sugar. Diverse studies suggest even macular pigment density, eyeball's natural filter against UV blue light, is higher in active people, which can protect against AMD progression. Although less studied, exercise likely also helps in glaucoma by boosting optic nerve blood flow and lowering intraocular pressure modestly, and in cataract prevention by promoting general metabolic health. Plus, exercise raises levels of protective nutrients since fit people often have better diets. In sum, regular aerobic exercise, brisk walking, cycling, swimming, etc., and even strength training can enhance ocular perfusion and counter harmful processes. Even moderate routine exercise is linked to slower progression of early AMD, and we saw benefits in diabetes-related eye disease from higher activity. The takeaway: the more and earlier one exercises, the more the eyes benefit. Smoking cessation. Smoking harms the eyes in multiple ways. Nearly every major eye disease is worsened by tobacco. For the macula, extensive evidence shows that current smokers have a substantially higher risk of AMD. A recent meta-analysis found that current smoking increased AMD risk by roughly 25 to 30%. Quitting gradually lowers that risk, but the damage to retinal cells from years of smoking can last decades. Smoking also accelerates cataract formation. Reviews have consistently found a strong association between smoking and cataracts. One long-term study showed current smokers had about 42% higher cataract surgery risk than never smokers, and that risk fell toward normal after 20-plus years of quitting. In other words, the lens appears sensitive to oxidative damage from tobacco, but stopping smoking, even later in life, can recover some of the risk. Smoking likewise influences diabetic retinopathy. A meta-analysis of 73 trials reported smokers with type 1 diabetes had 20% higher risk of any retinopathy than non-smokers. Results in type 2 diabetes were mixed but showed similar trends. While smoking's effect on glaucoma is complex, it is known to reduce antioxidants and harm blood vessels, both worrisome for optic nerve health. Overall, tobacco smoke elevates oxidative stress and inflammation in the body. It depletes macular carotenoids and vitamins like C and E, damages retinal blood flow, and promotes lens oxidation. The simplest advice: smoking cessation is one of the most powerful lifestyle changes for eye health. Patients who quit smoking not only cut their AMD and cataract risk, but also improve circulation and reduce systemic disease load, indirectly benefiting the eyes. Metabolic health: weight, blood sugar, blood pressure. Optimal metabolic health underpins visual health. Chronic conditions like diabetes, high blood pressure, and obesity are major risk factors for eye disease. Diabetic retinopathy is directly caused by poorly controlled diabetes. The longer blood sugar is high, the more microvascular damage occurs in the retina. Numerous studies and trials have shown that tight glucose control in diabetes dramatically reduces the onset and progression of retinopathy and diabetic macular edema. While a detailed discussion is beyond our scope, practically this means controlling HbA1c, blood pressure, and cholesterol are as important as diet and exercise for protecting vision. Exercise and diet help here too. For example, the activity and diet changes mentioned above also improve diabetes control, yielding double benefits for the eye. Metabolic syndrome: the combination of high blood pressure, high blood sugar, excess weight, and abnormal cholesterol also affects other eye diseases. For hypertensive patients, well-controlled blood pressure slows the progression of retinopathy and probably reduces risk of vision problems in general by relieving stress on retinal vessels. Obesity is linked to cataract risk. A 2025 meta-analysis of 10 studies found that adults with metabolic syndrome had about 25 to 30% higher risk of developing cataracts than healthy weight adults. The risk was stronger in older people. This is likely due to metabolic and inflammatory changes in obesity that accelerate the lens aging process. In AMD, some work suggests that a healthy weight and lipid profile can be protective, though genetics and age remain dominant factors. In glaucoma, systemic factors like sleep apnea, blood pressure dips, and overall vascular health can influence optic nerve perfusion, so good cardiometabolic health is thought to help here too. In some, managing weight, blood sugar, and pressure is a key lifestyle lever. Even if we focus on diet and exercise, their benefits partly flow through these metabolic improvements. For patients, this means monitor your diabetes carefully, keep blood pressure in check, often via diet, exercise, or medications, and strive for a healthy BMI. Such measures have documented dose-response effects on eye disease. For example, a weight loss or blood pressure-lowering diet in diabetics is known to slow retinopathy progression. Every incremental improvement counts. Dose response and timing of interventions. How much and how soon matter greatly. In general, more intensive adherence to healthy habits yields greater eye benefits. For example, in the diabetic retinopathy study above, those with the highest activity level, 14 sessions a week, had a hazard ratio of 0.61 for disease progression versus very low activity, meaning 39% lower risk. Just moderate activity had a hazard of 0.78, so there is a clear gradient. Similarly, analyses of Mediterranean diet adherence often find the biggest difference is between the highest and lowest tertiles. In one trial, median high adherence gave 17% less drusen progression than low adherence. These effects are additive and gradual. Starting earlier usually gives more time for benefits to accumulate. Many eye conditions take decades to develop fully, so adopting healthful habits in midlife or earlier is ideal for maximal prevention. For instance, quitting smoking at age 50 still slows cataract risk, but quitting in your 30s would be even better. However, it's never too late to start improving lifestyle. Even those who already have early lens changes or background AMD can benefit from making changes now. At worst, you have prevented further harm. In fact, studies show quitting smoking yields incremental vision gains even after many years of exposure. In practical terms for patients, beginning healthy habits at any age helps, but starting earlier helps more. Emphasize gradual increases too. Small steps like adding one extra serving of vegetables per day or swapping one snack for exercise can build over time. Clinicians should encourage patients that some is better than none, and that cumulative gains are seen with higher intensity or prolonged effort. For example, telling a patient that each weekly exercise session or each extra fish serving further lowers risk can motivate dose response. Integrating lifestyle counseling into eye care. Eye doctors and optometrists see patients regularly, a perfect opportunity to reinforce healthy habits. Here are practical strategies clinicians can use. Routine screening. Include brief questions about diet, how many servings of fruits, veggies per day, exercise, how often do you walk or do vigorous activity, and smoking status in patient intake forms. Even a quick, do you smoke with follow-up, interested in quitting, can open the door. Clear messaging. When diagnosing or monitoring a patient, frame advice in terms of eye health. For instance, quitting smoking will help protect your macula and delay cataracts, or this dietary change can reduce retinal swelling. Use patient-friendly terms, eye vitamins instead of complex nutrient names, etc., and emphasize benefits. Printed materials and referrals. Keep brochures or handouts on eye-healthy eating, high in green leafy veggies, fish, nuts, and exercise. If possible, have vetted links or apps to share. Also coordinate with primary care or nutritionists for patients needing more help with weight or diabetes. Making clear eye health is part of overall health. Set achievable goals. Instead of listing many changes at once, help the patient pick one or two to start. For example, advising try to add a colorful salad a few times a week, or aim for 30 min of brisk walk 3 times this week. Praise small successes at follow-ups. Multidisciplinary approach. For patients with existing disease or high risk, e.g., eye clinic patients on retina specialist, mention lifestyle as part of the treatment plan. For example, alongside recommending injections or glucose tests, say, adding these healthy habits is like an additional medicine for your eyes. Leverage success stories, sharing stories. A patient improved her retinal health after changing habits, or showing fundus photos over time can motivate change. Clinicians should seize teachable moments. Any test or exam that reveals early disease can be a cue. These findings improve when patients adopt lifestyle changes. In busy practices, even a 1-2 minute ask, advise, refer approach can be impactful. Research shows doctors often underutilize lifestyle counseling, but even brief advice increases patient motivation. By routinely making lifestyle a topic of eye visits, providers reinforce to patients that their daily choices count for vision. Over time, small changes add up. Eye care professionals play a key role in educating patients that diet, exercise, quitting smoking, and metabolic control are not optional extras. They are integral prescriptions for a lifetime of better vision. Conclusion: our eyes are largely in our control. While we cannot change genetics, we can powerfully influence eye aging through lifestyle. A diet high in fruits, vegetables, fish, and healthy fats, think Mediterranean pattern, combined with regular exercise, no smoking, and good control of blood sugar and blood pressure, can significantly extend the health span of our vision. These habits fight the oxidative stress and inflammation that drive AMD, cataracts, glaucoma, and diabetic retinopathy. Importantly, research suggests dose matters. The more completely and earlier you adopt healthy habits, the greater the benefit. Eye care providers can reinforce these messages at every visit. Ask about habits, provide eye-specific dietary tips, and work with patients on realistic goals. Even replacing one sugary snack with fruit or quitting one cigarette per day is a step toward protecting eyesight. Patients should feel empowered. Better food and more movement truly are medicine for your eyes. With consistent lifestyle changes, people can often delay serious eye problems and maintain clear vision for many more years. Sources: this guidance is based on a wide range of recent studies and reviews. For details, see research synopses and clinical recommendations, e.g., large cohort and meta-analyses of diet and eye disease, exercise and diabetic retinopathy, and smoking with eye outcomes, among others. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.